Hello, my name is Maria Munoz, and today I'll be presenting my case study on emphysema. A typical person presentation would be shown as a 47-year-old man with a history of smoking 2 packs of cigarettes in a week for the past 25 years of his life, has been complaining of coughing that has only worsened. He has a feeling that he cannot get enough air and is continuously wheezing, and he has a long-term history of mucus production. And here we're presented with the etiology of emphysema. To start off, the cause of emphysema is usually long-term exposure to irritants that damage the lungs and the airways. Exposure to other inhaled irritants can contribute to emphysema, such as tobacco smoke, marijuana smoke, air pollution, or chemical fumes and dust. In rare cases, a genetic condition called alpha-1 antitrypsin deficiency can play a role in causing emphysema. The destruction of alveoli and production of mucus are due to the response of the injury. Before moving on, let's take a look at the background of emphysema. Laennec described emphysema of the lungs in 1821 in his Treatise of Disease of the Chest. He was also the inventor of the stethoscope, who wrote that emphysema lungs were excessively inflated and that did not empty well. Moving further into the disease of emphysema, we can start off with the risk factors. The main risk factor of emphysema would be smoking. Any type of smoking, especially cigarette smoking, could increase your chances of getting emphysema by a greater percentage. And long-term exposure to other lung irritants, as mentioned before, secondhand smoke, air pollution, chemical fumes, any type of smoke, marijuana smoke, and cigarette smoke could increase the chances. And older people of 40 plus are at higher risk of getting emphysema. And also, as mentioned before, there is a genetics condition that is linked to emphysema, and that's going to be alpha-1 antitrypsin deficiency. And also, childhood respiratory tract infections are known to be contributing factors, only if they're recurrent and severe. Moving on into the pathophysiology of this disease, we can start off by discussing the permanent enlargement of air spaces distal to the terminal bronchioles, which leads to a dramatic decline in alveolar surface area available for gas exchange. Now let's just take a look at this quick picture here. In the left side, you can see a normal alveoli, and on the right side, you are presented with the alveoli that has presented with emphysema, and you can clearly see the differences between both of them. Continuing on to the pathophysiology of emphysema, we can start off by characterizing it by its destruction of alveoli through the breakdown of elastin within the septum, by an imbalance between proteases and antiproteases, an oxidative stress, and apoptosis of lung structural cells. In addition, we also have large air spaces within the lung parenchyma, and air spaces adjacent to the pleura are produced by alveolar destruction. Also, within the pathophysiology of emphysema, we see the ventilation perfusion mismatching and hypoxemia are results of ineffective gas exchange between bullae and bulbs. Moving further into the pathophysiology of emphysema, we see that expiration becomes difficult, leading to air trapping. Air trapping can cause a variety of things. One of them could be a hyper expansion of the chest, which can also lead to an increased work of breathing, which obviously is not a good factor to bring into the body. And then with ongoing disease, this leads to hypoventilation. This is obviously more long-term. And persistent inflammation in the airways can also result in hyperactivity of the bronchi with bronchoconstriction. The destruction of alveolar walls and pulmonary capillaries also cause pulmonary artery hypertension. In addition, increased work of breathing requires additional calories, so progression of the disease can lead to a great weight loss. Now that we have discussed the pathophysiology and etiology and the risk factors of emphysema, we can move on to the symptoms. Obviously, every patient is different, but one of the most common symptoms presented by emphysema patients would be the shortness of breath, which is usually due to light exercise or climbing steps, or usually it's caused by anything that is considered to be a daily activity. And then an ongoing feeling of not being able to get enough air is usually one of the most common symptoms. And then a long-term cough or smoker's cough or worsening smoker's cough. This goes back to one of the main risk factors being smoking. Obviously, this is one of the most common seen side effects, symptoms. And then that goes back to the wheezing. Long-term mucus production caused by the injury, of course, and then ongoing fatigue and prolonged expiratory phase. Now moving on into the diagnosis, which is how we can determine whether somebody has emphysema or not. To start off, we have x-rays. So x-rays are usually not really used to detect early stages of emphysema, since they're usually not that helpful. We have better options out there, but they can be beneficial for more severe cases. Chest x-rays and CAT scans are both successful at diagnosing, just not our first option. And then we have pulse oximetry, which is also known as oxygen saturation test. This test is used to measure the oxygen content of the blood, which is usually reduced when it comes to emphysema. Then we have the spirometry and pulmonary function test, also known as PFT. So this test is basically done by taking a deep breath and blowing into a tube that is hooked up to a specialized machine. Then these test results are compared to normal results from people of similar gender, age, height, weight, and ethnic background. We also have the arterial blood gas. So this test basically measures the amount of oxygen and carbon dioxide in the blood from an artery, which would be usually presented with a high partial CO2 and a low partial O2. And then we also have the diminished FEB1, which is forced expiratory in 1 second. Practically, in other words, it's the amount of air you can force from your lungs in 1 second. This test is actually almost within the same procedure as the PFT. Well, it's not the same, but it's very similar. It involves forcefully breathing out into a mouthpiece connected to a spirometer machine. So either way, in both tests, you end up forcing a breath out just to measure the outcome. And fortunately, there is treatments for emphysema. So to start off, we have bronchodilator medications, which is medicines that relax the muscles around the airways. And then we also have anti-inflammatory medications. So these are actually usually avoided, or at least is one of the last options due to the long-term effects on individuals. But these medications reduce inflammation in the airways. Another treatment would be oxygen therapy. Oxygen therapy is prescribed for patients whose lungs are not getting enough oxygen to the blood, usually long-term for hypoxemia, which is one of the symptoms. One of the things emphysema can lead to, and hypercapnia patients. Also, lung volume reduction surgery. So removing a portion of diseased lung tissue, then joining them together with the remaining tissue. This procedure is usually just for a selected individuals, which is usually caused in severe cases. And then that's